diagnosed with the BRCA mutation, which is a genetic mutation that gives you a really high risk of breast cancer. During that time I had met with a genetic counselor, and she kind of told me that the process would be, and my breast surgeon had told me that the process would be a mastectomy, you know, all the skin, everything gone. You get expanders and they expand out over a period of about 4 months, and then you exchange them. I was really unhappy about that, especially as an elective surgery, to have that be my end result. I saw, you know, pictures of people who had that mastectomy, and everybody's seen it with the, you know, giant scar across your chest and no nipples. I had known Dr. Krummen from meeting her and doing the fillers with her, and I knew that she also had done breast procedures, and that was what she was known for. She just instantly said, "No, you can do a nipple sparing mastectomy, direct to implant. I do it all the time." She just makes it seem like, you know, this is normal and this is fine, and we can do this, and this is what we can accomplish with this surgery. Cut would be, you know, just under right here. So it is, I have a scar right here just under my breast, and then I woke up with implants. I woke up with my natural looking implant breasts. So it was just, I felt like so much less traumatic than having to, you know, do the expanders and everything for 4 months. I wasn't allowed to do any kind of extension of my arms, so I couldn't brush my hair, I couldn't brush my teeth. I hadn't had a bath or a shower because I didn't want strangers to give me a sponge bath, so I was rough. I'd been in the hospital for 4 days. She had called and said that she would like for me to stop by once I was discharged. And as soon as I walked through the front door, Tina was standing with the door open so that I didn't have to like sit in the waiting room and wait while, you know, I look a mess. So that was really nice, because that was something that was in my head of like, great, I'm gonna have to go and sit in the waiting room and this is gonna be awkward. But they got me immediately into a room. They were waiting for me. For me, this is what was right, and it feels so much more comfortable, and I feel like so much less traumatized by it than other people that I've seen, just because it was such an easy procedure. I just kept telling my husband, I can remember on the car ride home, just telling my husband over and over, like, I'm so glad I knew about her. I'm so glad I knew about her, because I mean, he's my husband. He loves me and he was going to support me no matter what, but he was really uncomfortable with that other procedure as well. It's just a really different result. She doesn't give you unrealistic expectations. She tells you realistically what she can do. I would trust her to do any surgery because I just know it's going to be okay.